Sean McAnally here with Dr. Bill McAnally, the father of Aloe. Guys, Dr. Bill is going to talk to us today about aloe and chemotherapy and how aloe can really help in the chemotherapy situation whenever someone needs to take that due to cancer or something. Okay? So without further ado, Dr. Bill.
Yeah, I was really excited when this study came out, and it's done in Italy. They had 240 patients randomized. Half of them took just chemo, and the other half took chemo plus an ounce of aloe vera.
Okay.
And that's just aloe vera juice. And all of these patients had metastatic cancer.
Mm-hmm.
And we're dealing with lung cancer, colorectal cancer, stomach cancer, and pancreatic cancer.
Oh, wow.
These are all bad cancers even now.
Well, my grandmother had one of those.
Yeah. Well, they're some of the most common.
Mm-hmm.
And what's interesting is after the first 6 months, 70% of those on chemo were still alive.
Mm-hmm.
And 90% of those with the combination were still alive.
Wow.
And then in a year, 40% with just chemo were still alive and 70% with a combination. It goes on down. And what's most impressive to me is normally about 3 or 4% of these people survive 3 years, and that's what they had.
Mm.
But those with aloe too, 20%. So would you rather be in the 4% group or the 20%?
I'd rather be in the 20% group.
So here it is with virtually every chemo known.
Mm-hmm.
And I don't know how many times I've heard people say, well, my doctor told me not to take it. Well, show him this study.
Mm-hmm.
He needs to get out and read.
Well,
about
continuing
the science.
education.
Continuing education.
That's right. You got to continue to
And
learn.
The way they work is if they don't know, they say no.
Yeah.
So this study was published in 2009. It's a PubMed paper, and it's free. You can get the whole paper free.
Wow.
And that's definitely additive and more than likely a lot of synergy between them.
Good deal.
So that's the first point I'd like to make. And then we have other studies that I participated in.
Mm-hmm.
And this was a long time ago with aloe.
Mm-hmm.
And we showed that this was in 1991.
Mm-hmm.
That's 30 years ago.
Yeah.
Look who's...
I see your name there.
Yeah.
And I remember this guy. I think we called him Bob, though.
Yeah.
Yeah.
And Dr. Kemp, he and I went to Belgium a lot. We were doing studies there with humans.
Mm.
And he was with Texas A&M at that time. And what they showed was that Ace Manning was synergistic with AZT and acyclovir in inhibiting the AIDS virus.
Oh, wow.
So that's part of what we did to get us to where we could do our study. And we did a big international study in Canada and in Belgium. And what we were doing is what Fauci's group told us to do.
Mm-hmm.
And when we got the results that he said would give us approval, we went in there. Only one person showed up.
Oh, wow.
There were 30 there the time before, and they said, well, we changed our mind. We got different criteria now.
Mm.
That's after we spent millions of dollars in 2 years.
Mm.
So it's interesting, all the politics in this.
Oh, yeah.
Then here, aloe vera, the studies keep coming out. 2015, people wondered about cisplatin, which is used on all kinds of cancers. And aloe vera is synergistic with it. you can have a better effect with a lot less cisplatin. There's a
Wow.
lot less toxicity. So you can show these studies to your doctor if they have a question. Here's 2019, where they showed that aloe vera reduces the toxicity of malathion and other, insecticides, and will probably show the same thing with herbicides. So its ability to significantly, if not synergistically, prevent the damage, it protects it so much. That's a 2019 study. So there's more studies coming out, and more proof. I don't have any studies that say it's bad. All I have is study after study saying it's going to be additive or synergistic.
That's right.
So aloe is something everyone should take every day. If you can't afford it every day, buy a bottle and share it with your family every month or two. At least you can fix the cells that need to be fixed at that time with those pathways.
Some's better than nothing.
That's right.
Always. Always. Dr. Bill, thank you so much. Guys, this was a little bit about synergy and aloe and how it works well with other things. Stay tuned because we're going to talk about some other plants that work really, really well. And guys, there'll be a link at the bottom in the description to the studies that Dr. Bill was talking about. Thank you so much. Until next time, this is For the Health of It.